everyone. This is Dr. J with the Human Movement Institute, where we have improvement through movement. Today we're going to discuss a very unique and special muscle known as the Splenius Capitis. This muscle starts at the base of the skull and goes down on an angle from anywhere from this upper cervical to C2, C3, clear down to T2, T3. It almost looks like a V on the back of your neck. This muscle is known to cause a very odd or unique symptom that some patients may complain of. This symptom is pain on the top of the head. The patient will literally say, "I have a headache or pain on top of my head." It can radiate out a little bit. You can also have pain in this muscle locally where it lives under the upper trapezius muscle. So again, Splenius Capitis. How do we release it and or mobilize it? This muscle works controlling the head coming down. It works as it contracts on both sides looking up. So if you're that person looking up a lot, or you're a person laying that reads a lot, the Splenius Capitis can become overactive, have tension, tightness, or pain in it. Also, if your head's slightly tilted one way versus the other, one side can become more active or more tight than the other side. To release it, we can do this standing, sitting, or lying. A lot of times I might be doing work on my stomach. I get off of my stomach and I will start to find the base of the skull. I'm then working down to the vertebrae from the base of the skull with muscle. Here I'm doing an active release where I look down and away and back and up. I'm going with muscle fiber. Sometimes doing this 5 to 10 times can totally resolve the pain in the moment. It can also be done prophylactically throughout the week. This may only take you 1 to 2 minutes or the 10 to 20 repetitions to release it. If you have a more recurrent case in the human movement diagnosis of Splenius Capitis hypoflexibility or an overactive Splenius Capitis, you might be the patient or person that has to lay down. By laying down, we can relax the cervical musculature. I can use opposite hand or same hand to release the Splenius Capitis. Again, I'm going from the base of the skull, mastoid process, down on an angle to the vertebrae. You can use mobility tools, but this muscle is a little deeper and it takes a little more detail to get to it. Yet again, why the human movement diagnosis is so critical. I'm also working just to the side of the vertebrae. You'll feel those bumps down the center of your spine, of your neck, and upper mid-back. Those bumps are called the spinous processes. That Splenius Capitis connects down to the sides of those spinous processes. So many people can find that the pain is most right along as they press or push on just to the side of that bump. I can hold by doing a traditional trigger point release on the sore spot for 5 to 10 breaths, 2 to 3 times. I can also move it by looking down and away to do an active release or reciprocal inhibition. Or I can do deeper pressure with fiber or cross fiber. This can be done prophylactically for prevention once a week, or as needed for 5 to 10 minutes for short-term pain relief. In the end, we want to find out the perpetuating or causative or etiological variable or factor that's causing the splenius capitis muscle to work overtime. You will know that your technique is correct if the headache pain or the pain on top of the head goes away quickly. Once you reposition head over neck, you can decrease the activity of this muscle to have long-term relief of headache on top of neck. If you like this video, please hit the like button, the subscribe button, and share it with your friends and family. Until next time, take care, and I'll see you all again soon.